It is helpful to have developed your own plan for how you will get to the hospital when the call comes. Don't forget to plan for child care, pet care, temporary lodging and meals for your family during and after your transplant. Don't forget to plan for added expenses, such as the cost of parking at the hospital. Consider whether you will have a loss of income during this time and plan for how to manage your expenses. Be prepared. Review your plan periodically and make changes as necessary to stay prepared. The call to offer you a donated organ can come anytime, but it often comes in the middle of the night. It is important to always answer your phone, even when you do not recognize the caller's telephone number. Once the call comes, you will be instructed to come to the University of Michigan Cardiovascular Center, or CVC, for your transplant. Stop eating and drinking immediately. Drive carefully and wear your seatbelt. Be sure to bring the essentials you have packed for this trip, including telephone numbers you may need and money for parking. Bring your medications and enough oxygen for a round trip to and from the hospital. Please bring your patient education guide, as that will be used after your surgery to teach about the medications you will take and how to care for yourself when you go home. When you arrive at the CVC, proceed to the area of the hospital as instructed by the transplant coordinator who called you. A clinical trial, also called a research study, is a study that helps test whether a new treatment or medication is safe and effective, or whether older treatments produce the best results. In organ transplants, previous studies have been very important in finding the best way to care for your new organ. Clinical trials have been found to be the best way to make sure new drugs, devices, and procedures are safe and effective. Prior to surgery, you may be asked to participate in one of these studies. You are not required to join. You must volunteer in order to be able to take part in a clinical trial. A decision should be made after you have full knowledge of what is involved. Taking part in a clinical trial may or may not improve your health. You may be one of the first to try a promising new drug, or you might receive the standard or regular therapy. All clinical trials are reviewed and approved by a safety and ethics board before any patient can be enrolled in a study. Patients will meet with a member of the clinical research team who will explain the studies and answer questions before the patient makes a decision. Each patient enrolled in a clinical trial is monitored very closely while participating in this study. Whether you choose to join a study or not, you will be cared for by the Transplant Center team of dedicated professionals who are interested in your health. One of the most important reasons for joining a clinical trial is a desire to help advance what is known about new treatments.